since Obamacare became law, there have been so many problems with it, but I found something that has resulted in actual deaths, so I have to share it. So, in Obamacare, there was established a program, and hospitals are being fined if their readmission rates for Medicare patients are too high. So here's the deal. If a Medicare patient goes into the hospital and, say, has a surgery, and then he comes back to the same hospital within 30 days and gets readmitted, that's the readmission rates. But it also applies if he goes to a different hospital. The first hospital is still punished, is still levied with fines. Now, a study that was published in the Journal of the American Medical Association said this resulted in actual deaths and higher mortality rates following these surgeries. So, the Hospital Readmissions Reduction Program was created as part of Obamacare because some bureaucrat, some bean counter somewhere, said that unnecessary admissions are costing $18 billion a year. We don't know for sure where he pulled that number out of, but that's the number that they're using to justify the program. Well, what gets me is the list of different things. You see, hospitals were incentivized to keep readmission rates low for certain different surgeries and conditions. They include heart attack, heart failure, pneumonia, COPD, which is chronic obstructive pulmonary disease, hip and knee replacements, and coronary bypass graft surgery. These are all really serious. Like, I would expect that there to be a fairly high percentage of people following, say, surgeries or treatment for these to come back within 30 days, because they're all, well, pretty severe. Now, this isn't somebody comes in with a cold and he's back again with another cold. That's not what this is. But the government thought, or at least that's the excuse, the government thought that this would result in better surgeries. Now, what's the implication there? The implication is that surgeons are intentionally making mistakes. Or the doctors are intentionally making mistakes. And I don't think anybody thinks that's true. Sure, mistakes are made, but in order to incentivize doctors to, reduce admissions in the way that they're trying to do, you have to assume the worst. You have to assume that the doctor is actually intentionally doing this wrong for surgeries, and that's not true. So what happened was, in reality, bureaucrats aside, hospitals told sick people that they were okay. Let me explain. Sick guy comes in, and he has his, let's say, heart surgery, his graft or what have you. And then he comes back within, 15 days, and he's having another problem. Well, the hospital has 3 different potentials. They could admit him, they could send him to a different hospital, or they could send him away. For the first 2, they get fined. So instead what they do is they give him a pill or a prescription, or they tell him he's fine, and that's it, he goes away. And as a result of that, he dies. That's what we're talking about, because they can't send him to the other hospital and say, I'm sorry, there's a bureaucratic nightmare going on, so you're going to have to go to a different hospital. No, because they still get fined. So they're telling sick people that they're okay. And this especially affects poorer communities. And I'll tell you why. It's because in poorer communities, people wait. Like when they're sick and when they're having heart problems and stuff like this, they don't go to the doctors or the hospital until the very last second, until they absolutely have to go. Like they're on death's door, that's when they show up. And so it's these communities where you're going to have them showing up many times at the hospital in a short succession for a very serious condition, like, heart failure. But who has a heart attack alone and is otherwise perfectly healthy? How about heart failure? How often does that happen, that the guy has actual heart failure and in every other regard he's perfectly healthy? It usually doesn't. I'm not saying it doesn't, but most of the time that's not the case, because heart problems lead to kidney problems. Heart failure often leads to lung problems and can lead to COPD and so on. The human body is holistic. Everything interacts. You don't just have just the heart and it's isolated and that's all there is to it. So when you've got a person who's been admitted for something like heart failure or a heart attack, he's probably going to be back for other problems. That's just the human body. But bureaucrats don't think like this. Do you remember when Democrats berated and mocked relentlessly Republicans for using the phrase death panels? Remember that? Well, what Republicans meant by death panels was a bunch of bureaucrats weighing treatment costs against the value of human lives. That's what was meant. And you know what? That's exactly what we have here. Seriously, it's exactly. They looked at the $18 billion number that we talked about earlier. They said, you know what? Some of those people can die. I know, it sounds cold and crass, but that's what government bureaucrats are. They're looking at numbers, they're not looking at people. That's why you don't want the government in charge of your healthcare. And when the government makes mandates or laws, they can't be fixed on a whim. Like, even when they have, say, unintended consequences. Like, they looked at this number and they didn't think that people would die. And they found out later that, oh, oops, people are dying. It's hard for them to fix because it's laws enacted by Congress. They're not supposed to be able to fix it. Some bureaucrat can't just fix it. And that's the problem. It's why so many conservatives make jokes mocking how the government doesn't do anything as well as the private sector. It doesn't do it as cost efficiently. It's because they don't. They can't make changes because laws are laws. They're written on paper. You're supposed to follow them exactly. And let me tell you, right now, you might think that the biggest problem with American healthcare is that it's expensive. And you'd be right. That is the biggest problem with American healthcare. And I'm with you. We should lower the expenses, and there are ways to do that. Not like this. But wait until the government controls every aspect of your care. Because cost will be the least of your concerns. You'll have serious concerns about how they're valuing your life. This was about Medicare patients. And you've got people like Bernie Sanders, like Ocasio-Cortez, who want Medicare for all. They want this system for your life, regardless of your age, regardless of your income status, regardless of what you actually want for yourself. You won't be able to choose. Ironically, affordable healthcare requires the elimination of the Affordable Care Act. I know, it's euphemistically named, and it was always supposed to be. It was always, it was never going to be as affordable. You were never going to be able to keep your plan and keep your doctor and everything else. All the promises that they made were baloney, and they knew it when they told you that. Well, I only report this story because the reality is that these deaths, they don't mean anything to the government as a big bureaucratic body. But the death count will increase the more we increase government management of healthcare. Okay, if you enjoyed this video, please like it, and more importantly, share it with your friends. I can't do this without you. Also, I've got some links in the description below that will provide you with better ways to subscribe in addition to subscribing and hitting the bell on YouTube. I've also got links that will provide you with ways to support me in the production of these videos. Thank you to those who have already. Bye-bye.
Check out our official products at our home site, healthwise.org. We have been helping people to live better and healthier lives for a decade. Our products tend to be more effective than other products as they work with nature instead of against it. We recommend our colloidal copper lotion, which is our flagship product, or everyone's favorite, the dental cleanser. Thank you for listening and for your support.